Hello, everyone. My name is Erica Slayton, and I am the Military One Source Program Manager for the Department of Defense. It is the Monday before Thanksgiving, and we're starting off the week with another COVID-19 update on the resources to support you through COVID-19 and beyond. Now, during this pandemic, you may have had to change your travel plans to protect your loved ones, and particularly those who are elderly. Well, I want you to know that Military One Source provides specialized services to help you take care of the seniors in your life. And joining me today to talk about this service is Paul Fortney, a specialty consultant with the Military One Source call center. Paul, thank you so much for joining me on this very, very important topic. Would you please introduce yourself and then just share a little bit about your background?
Oh, my pleasure, Erica. Thanks for having me. And my name again, Paul Fortney. I'm with Military One Source. I've been an elder care consultant for about 9 years now. And prior to that, I worked for several years in the elder care field in various capacities. And so I believe I had a good bit of experience in how elder care works and what services are available prior to signing on with Military One Source back about 9 years ago. So that's kind of the background on me coming into Military One Source.
That's great. 9 years. Wow, almost a decade. That is absolutely fantastic, Paul. Thank you again for sharing your expertise. So, elder care consultation, can you talk a little bit about what exactly is an elder care consultation?
Well, generally what happens is when a participant service member contacts Military One Source for elder care consultation, it's a matter of discussing with them the needs of their particular family member. Generally, it's a parent. It can be a grandparent, aunt, uncle, family member, and listening to them and hearing what the situation is and what resources they're looking to locate, and then discussing with them the viable options for, whether they're looking for care in home or whether they're looking to place in a facility, and then reaching out to those resources in the community where their family member resides, be that with the service member or not away. And then also now, in light of COVID, that has kind of affected every sort of aspect of elder care, especially since the elderly are hit very hard by COVID. So it's checking with a home care agency to see what their procedures are for assessing a new resident and whether they're doing everything just over the phone or whether they're actually still going into the home to meet with the family, or maybe they're a mixture of both, whatever's based on comfortability. If it's placement in a facility, finding out what the procedures are, if perhaps maybe the family member needs to go into a separate quarantine area of the facility prior to admission, if there's availability there, or maybe what medical documentation the facility is going to desire from the healthcare provider of the elder family member in advance of them being admitted to, say, an assisted living or other sort of residential nursing facility. So, and being aware of what the guidelines are going on in that particular state and locality as far as COVID goes, and seeing what the policies of the individual facility or home care provider are.
Wow, Paul, that's a lot, and that's what I love about this Military One Source specialty consultation, because I don't believe a lot of people know about it. So I'm glad you're here to share with viewers this important service that we provide through Military One Source. As you're talking, you shared a lot of ways that you can support, but tell me, what are some common questions or areas of concern from military families as it relates to elder care?
Generally, it is how the service might be provided and what they're looking for. One of the most common requests we get to locate services is in-home care. So it's a matter of that the elder, and that is also a COVID situation. A lot of people feel in-home care is currently safer now than facility care because you only have a caregiver coming into the home to care for the family member. But if the condition is severe enough that it requires facility placement, then also that's pretty common as well. So housing, be that in an assisted living or in a nursing facility. And then there's also questions sometimes about transportation. It's sometimes hard for elderly people to get around. And then also questions about how they might be able to cover the cost of these through various government programs such as Medicare, Medicaid, VA benefits, TRICARE, and then also, if need be, having doesn't know how much the cost is for private paying for services. So those are kind of the main areas of concerns that people usually express to us about what they're looking for care for their family member.
Mhm. Yeah, thank you for sharing that. You know, when thinking about our military community, oftentimes military families are very far away from their loved ones.
Mhm.
And so, Paul, given that fact, how specifically can this consultation help our military community, especially when they're separated from their loved one?
Well, we have a good ability to search nationwide for resources through Military One Source. So it's just a matter of finding out where the service member is, where their family member is, and then getting that geographical information and then being able to reach out to providers in that area. And sometimes it is an issue where they want their family member to stay in the area where they are, or it's a possibility that they may want to move them closer to where they're stationed. So we can just nationwide search for pretty much anywhere in any locality and find the resources in that area. And then again, with COVID, being aware of what's going on in that particular area based on the government mandates and the policies of the local health departments and the state health departments, and what those providers, individual, say, company policies are in regards to protocols for dealing with elderly people and COVID.
Mhm. That's fantastic. So really, if military families don't know where to start, they can reach out to Military One Source and ask to speak with someone like you, Paul, and you will do the research for them. That's fantastic.
Absolutely.
As I'm thinking about Military One Source and the feedback that we constantly receive regarding our services, I just wondered, could you share a story where you supported a military family with this elder care consultation?
Absolutely. So sometime back, we were contacted by a um, service member who was a reservist, actually, but who was facing a deployment. They'd been the primary caregiver for their mother for an extended period of time, and the mother had physical and mental issues, Alzheimer's, dementia, and they were concerned about what they would be able to do when they were gone on their deployment and who would be able to care and provide care for their mother. So with that, we reached out to another option that we also search for called geriatric care managers. These are like consultants you can hire to help you more in-person services, and they usually know the local area. So we looked for 3 of those care managers in the local area. We also provide a listing of assisted living facilities in the area and information on the Medicaid waiver programs that can help with paying for care in assisted living. After following up with the participant, learned that the care managers that we provided proven to be a great help. They'd been able to locate facilities in the area, know which ones in the area were possibly good to work with, and also help them with those Medicaid applications to get those processed and get those filed, so that once the service member was on deployment, they knew that there was someone who could advocate for them in the case of the care manager, a facility where they could be safe, and they were receiving the government benefits that they were entitled to help cover their costs while the service member was serving the country on their deployment. And they were very happy for the resources we provided, and we're glad that we were able to help them out.
Well, I'm glad that you're able to help them out too, and I know that family is definitely appreciative of the service, especially as it relates to a deployment. Paul, that's fantastic. I do want to share for our viewers. Certainly, if you're interested in learning more about the elder care consultation through Military One Source, you can go to our website. But I would be remiss if I did not share that you can also find information about the elder care consultation through Military One Source's new My Military One Source app. So I do want to let you know that if you haven't downloaded the application, please do so. You can get it through Google Play or through the App Store. So please do that. I just want to show you, I'm going to draw your attention to the bottom screen here where you have various options once you've downloaded that you can select from. The option I'd like for you to see is Meal Life Guides. And so for Meal Life Guides, these are guides that have the must-know information about military life, and you can select a guide by category, or you can view all. In this instance, I'm going to go to view all, and then once you select view all on the Mill Life guides, what you'll be able to do is scroll down to specialty consultation, of which this is a Military One Source specialty consultation. And then through this consultation, you'll be able to see not only information about all the various specialty consultations that are available through Military One Source, but you can scroll down to see various articles. You can also scroll down to see related benefits. And if you look under related benefits, you'll see the elder care specialty consultation benefit. And then from this particular page, you can read all about the benefit. You can click into benefits details. And if you like this particular consultation, you may want to save it for later. You can click the heart at the top right of the screen, where then you can go back and that will be saved under your profile, and you can access that particular benefit later. So again, I just want to let you know that we are here through Military One Source to support you, whether it's our calling our 800 number, 800-342-9647, or certainly going to our website or the My Military One Source app. Paul, thank you so much for joining us today. It's been an absolute pleasure. And I do want to thank all of our viewers for joining us as well. Have a fantastic Thanksgiving week, everyone. Take care.
Thank you.